Hello and welcome to your official vibrational chronotherapy training. My name is Andrew Weaver, and on behalf of Bobby Joe Weaver and myself, we'd like to welcome you to NEHC Academy's training. So vibrational chronotherapy, or VCT, we're offering to you for free online, and that comes with a certification, with our certification. And the reason we're doing that is so that we can get our understanding and our concept and our perception of vibrational therapy out to the world. So VCT is more specifically using primarily unweighted tuning forks like this, and we're bringing that sound or that tuning fork therapy really close to the body. We're focusing on the body's timing systems, and that involves the nervous system itself and the sensors underneath our skin, which are designed to be able to sense vibration. They're called vibrotactile sensors, and we also use the auditory system as well. So this is primarily a special sense audio system, or a special sense, which is considered our audio system, and then everywhere else in the body, you have these sensors that are specially designed to detect vibration. And then there's the timing that goes along with that. So unweighted tuning forks, we're not doing diagnostics. We're not putting our hands or the tuning forks in this particular technique. We're not putting any tuning forks directly on the body. And this, I'm going to tell you, I'm going to get into what types of diagnosis or conditions your clients may have specific to doing a VCT session. Now, this isn't the only technique. This isn't the only thing that we teach at NEHC Academy. And that's not the only technique that we use in New Earth Healing Center. So that's the NEHC for us. We have clients that come in that have pain and mobility restrictions. We use our weighted tuning forks for those. We have a completely different technique for that. This particular technique and these sessions will be for the point that you've already taken care of those pain-based issues and you're working through the mobility issues. Your body still has problems with the timing part of the rehabilitation part and getting the body back into tune, which is usually what we think of. We're tuning our body with the tuning fork. So I'm going to explain from our perspective. It was back in 1989 that I ended up joining the U.S. Navy, and I was really focused on vibration the entire 22 years that I was there. And my job was underwater acoustics, which meant that you were putting sound into the water, and then you had sensors to be able to detect sound. What I've learned over the years, and even working with robotics and working with teaching at a Fortune 500 company afterwards for building automation, that a lot of technology really has the same synchronization and the same processes that our body does. It's not to say that our body is completely mechanistic or mechanic, but there's a lot of the things that the knowledge that Bobby Joe and I had that brought forward to developing these techniques that we have that really come to play. And we wanted to make sure that whether you're a seasoned veteran or whether you're someone who's just learning about tuning forks and you're buying sets and you're buying tuning forks, that you don't know how to use them or what to do with them, whether you're working on a family member or whether you want to do this as a living, we'll be able to pass that information on to you. So let me take this screen here and bring this down a little bit so I can talk about these bullet points. So the first bullet point is vibrational chronotherapy is synchronizing cells, and cells make up tissue, and then we have certain systems that really need to be synchronized to specific rhythms. Let's say, for example, I'm moving my hand, and when I move my hand, my brain, my motor neurons are firing a certain way, but I also need feedback to make sure that my hand's in the right position in space. There's a timing issue involved in that. That way the feedback coming to my brain to say I'm moving my hand, I have a good synchronization. The timing involved for impulses to go out to my body, and then sensors telling me that everything is working at the correct timing and everything is right. So it's very much going to be about rhythms, and it's going to be about patterns too. When you walk, you have to consider your body and your brain and where your brain thinks your body is in space and time. There's a pattern involved with the way that you walk, the way you swing your arms, the way you move your head when you're taking steps, and how the way you take your step is, or your steps is, in your gait is going to be different, whether you're walking on ice, or whether you're walking downstairs, or whether you're dancing and skipping while you're walking, or whether something is going wrong with your timing system and you can't feel your feet, or you're having some restriction to your mobility, or you have pain, so you change your gait. Your pattern changes as well. So this understanding of synchronization, we usually use the word tuning in sound healing. Well, our understanding of tuning, if you think of tuning from the standpoint of tuning instruments, well, that's one of the main reasons why these unweighted tuning forks were created to begin with, so that when we're tuning, let's say, a piano, we can strike this tuning fork. It is considered a set point to calibrate a musical instrument. So if I'm using this tuning fork and I strike it, now I'm able to hear this tone, a set point, and then I'm able to calibrate or tune or change the way that something in the instrument vibrates at, so that it matches this clean, consistent vibration. I set my instrument, or one note on an instrument, to set to this calibration here, and then from that point on, especially if it's like a guitar, then I can take each individual string of that guitar and make sure that they are all synchronized to each other. Your body works very much in the same way, where you have timings that are needed for certain processes within your body. And a lot of times, once those calibrations or those timings go out, we think that we may have healed ourselves from certain conditions, but our body is still running out of calibration in these things. And we get things like nervousness, stress. We get conditions where we have tremors and inability to move our muscles the way that we need to, and we even have behavior and cognitive issues that go along with tuning and synchronization. And that brings me to the next bullet point, which is focusing on chronobiology. So the understanding of timing in the body is such a big thing for the body that there's its own science, its own branch of science and research and biology, chronobiology. Now, the main player in chronobiology is something called a circadian rhythm. And we usually hear that word circadian to mean that's the day and night cycle, or the cycle for an entire day-night, or an entire day. Now, circadian really means about a day, which means primarily light and dark. Now, the amount of light and dark you get is going to depend on where you are in the planet. But our brain, there's a certain spot in our brain, there's certain cells in our brain, the suprachiasmatic nucleus in our brain. It's just on the little bit towards the end of our optic nerve, where we process the timing. So you can see that there's an input from light and of course dark cycle throughout an entire day. That would be considered one of our main time setters for our body's biological clock system. It would be considered our master clock by many people. So this understanding of chronobiology is usually tied to circadian rhythms, which is your ability to know that there's a cycle of so much light during the day and then so much dark during the night. Your social clocks are built to that. When you eat, when you do certain things, when you sleep, how long you sleep. A lot of study that's been done on circadian rhythm is usually usually studied because of sleep problems. So there would be certain therapies clinical therapies that would be involved in resetting or changing our circadian clock, a master clock. If you understand the circadian clock, then everything else kind of runs off of that, because you have certain rhythms that happen often in less than a day, digestive processes, sleep, things like that. We have also in chronobiology the use of medications, understanding 2 points that with medications, pharmacological approach to healing the body is by administering medications during certain times where we know that the body is expecting our own body chemicals to be released during those times. So we would administer time-delayed medications, and also or medications specifically built to release themselves at a very exact time. So we have things like that. So the clinical approaches to chronobiology up until this even current time is that we're not really using a whole lot. We're trying to force. We know that we can change the body's time clocks, and I'm going to get into what those terminologies are and what the science is behind that. But it's usually focused, anytime we think of chrono and circadian rhythms, we think of the day and night cycle. That's such a small part of this story, as we learned as we dug deeper and deeper into the details of chronobiology. And what we found is that we have the ability through vibration, and as long as we introduce the vibration in a very specific way, our body does in fact respond to the vibration. And we've actually combined many things that we learned through research, and the protocols that you're going to see from us in VCT are based off of the things we know about the body, where vibration itself from the tuning forks are really going to aid in the ability to heal the body. And again, that's going to be something to where you've already taken care of a lot of the other stuff, where the person like Lucy here, she's no longer in pain, she's moving well, but then it takes a little bit of time of rehabilitation, whether that's by a licensed physical therapist or physiotherapist or something like that. They're still getting the body back into the same condition that it needed to be in to operate efficiently. There's always some sort of rehabilitation afterwards. So I'm going to talk to you about what are those different conditions, what are the different diagnoses that you may come upon with a client to come into your office. So I'll talk about that here in a few minutes. Focusing on the nervous system and what we call vibrotactile sensors. So Lucy here, she has in her nervous system, we know about the neurons up in the brain. Those fire in sometimes very specific timing sequences. We already know that there's a clock of 10,000 cells inside this suprachiasmatic nucleus, the CSN. We know that that's where the circadian rhythms are stored, and there's neurons that fire in repetition and rhythms. And then we have the nervous system firing things outwards into our body to move our muscles, to do certain things with our organs, the timing system that controls everything. There's pulses being sent out through the nervous system. And more importantly, I feel, is the sensors coming back to tell you whether an action has a consequence. The brain can't see the outside world, even though there's eyes attached to your brain as a special sense. Your brain needs to not be surprised. So your brain actually maps out and predicts what you should be doing with your body, whether it's moving, whether it's laying down, whether it's doing autonomous things like heartbeat and respiration, digestive processes, things like that, chemicals being released at certain times. Your brain doesn't know what's happening in your body. And the sensors in your body, it's placed throughout your body, is feeding back, and your brain will map things out. The timing involved in the sending information back and forth, the axons in a nerve and how long it takes to fire down that nerve, and how long does it take for things to get back to your brain. Where are things in space? Vibrational chronotherapy really is about space. Where is everything located in her body as she's laying here, and where does the brain think everything's located, and the amount of time it takes for our information to travel back and forth. When those timings are off, then you get really then you get problems. Even though there's no pain, and even though there's movement still, there's still a problem with the ability to move and to understand where things are in your body. It can even lead to cognitive things, where you have an overloading of sensors because everything's coming in, or you have behavioral problems or memory problems. It's all based off of timing, and we're going to show you those things. We're dealing with unweighted tuning fork sets. Now I have a set here that's actually the brain tuners. It's actually a set of 5 tuning forks, and in this case we're not only using these binaurally, which we're putting them one by each ear, but we also use them in different ways where we can put the tuning forks together in a certain pattern, and we can do tracking of our audio system with our visual system as well. And what we're really doing in cases like that is we're taking and we're using a tracking system that our body always has, and sometimes that gets kind of messed up over time. And we're doing what the body, we're helping the body do what it does naturally, which is your perception across your visual field, and the ability for your auditory system to fire a certain way to know where everything is in space. A lot of times we use more than one sense. So we can work around the head area when it comes to vibration, and then we can work on the body when it comes to the sensors that are based off of waiting for vibration to come in. We actually have sensors. It's not just all pain sensors that we have just underneath our skin. There's actually vibration-based sensors that are designed to take this tuning fork and to feel the vibrations coming into our skin, and then to actually fire impulses up to the brain so that we can map things out and know the timing of the frequencies. We actually dug into understanding this whole process of the nervous system and the vibrotactile sensors, very specifically to the unweighted tuning forks. On this next screen, you can see that we have 2 techniques that we're using. So when we would have clients come in for pain and mobility restrictions, we use the we use the weighted tuning forks right on the body in what we call vibrational fascia release technique, or VFRT. This is something that we already have vibrational therapists throughout the world, and we have trainers throughout the world. This is where we get a lot of our funding in for our ability to be able to provide VCT training to you. So we want to make sure that you understand that we have 2 different parts here. So you will find times where I reference VFRT that, let's say for example, you're working with Lucy and she has Parkinson's, and we would want to use one technique to make sure that the muscles, the pain involved with certain symptoms associated with that disease would be resolved through one method, but there's still the timing. When we have Parkinson's clients, there's some things that we have to do afterwards that we would continue doing rehabilitation to make sure that the gait is right. Once we actually get communication flowing again, then there's VCT would be that follow-on training. Another example would be if she just had stroke paralysis, we can get through VFRT, we can get her moving again by removing the restrictions. But after the restrictions are removed, I'm sure that you're aware that most stroke patients, that they have to go through physical therapy and learn how to walk again or learn how to move again. Not only is there the atrophy of the muscles, but then there's also the timing. You have to remap things in the brain. You have to remap the timing as well. And that's what VCT is for. So just keep that in mind, that we actually have two together. They really are a package for us. And I know that you may come into this and only have VCT, and that's fine. You may have your own methods for taking care of the pain and mobility restrictions. But we want to make sure that you understand that when a client comes in, that you're not using these unweighted tuning forks in a manner to try to force some other type of healing to resolve pain, even though she might leave here with some resolved pain, but that's not our focus on this particular session. There's better ways, there's faster ways, there's more efficient ways of working through these particular sessions. So make sure that you separate the two techniques that we have. A lot of our therapists make sure they get training in both areas, and you can take the training in either order. So one of the things that we learned with chronobiology and the timing systems of the body is that these clocks, and I'm not just talking about, of course, that circadian clock, but there's also other timings as well. The auditory system has its own timing. Our visual system has its own timing. And then you have motor control timing throughout the entire body that again would be firing of our muscles through the motor control system. And then what was the consequence of that? Did that muscle move? Did that joint move as far as it needed to? Did that muscle do the job? Do I need more? Do I need to compensate? This is what the brain's thinking all the time. And that's where you start to get this jitteriness, or you can even have tremors, or how you have restless leg syndrome and those sorts of things. That all has to do with timing. Now, what's making that timing messed up? It could be degenerative axons, where, like in MS, the wrappings of that axon starts to degenerate. So now what the brain thinks is supposed to be the time it takes for your nerve ending to say, hey, my joint or part of my body is here now that you've moved it to. By the time the feedback loop gets up to the brain, it's there at a time that the brain wasn't expecting. So it doesn't know that this is the consequence of a sensor feeding back to the brain, that's the consequence of the movement that I just sent out there. There's where you start getting what we call short cycling in automation industry, where I've seen short cycling when I was in robotics, where a robotic arm might do the same thing. There's actually a tremor associated in a robotic arm. When I worked for a Fortune 500 company teaching building automation, ventilation, air conditioning, and fire control, and alarm systems, security systems, they all had these same problems with short cycling, where the feedback mechanism wasn't working correctly, and the timing that involves sending that signal back to the brain, that the device that was being activated that needed the feedback signal to be correct, you would actually get this short cycling where you would hear things buzzing or clicking. You may have heard that yourself in your ventilation system, where a duct might actually just start moving in place like this. Our muscles do the same thing. We might feel jittery or nervousness Sometimes that has to do with timing being off. And then we may have the lack of a muscle moving the way that it needs to, and the brain just not knowing where it's at. A lot of research has been done in understanding of our nervous system because of things like phantom limbs. So when we started learning all we could about limbs that were no longer there, there's where we really understood how the brain deals with things that we've mapped out our body. Our brain really needs a mapping system to predict where everything already is, so that you can make these split-second movements whenever your thought, or even whether it's a reflex action, which doesn't even involve the brain, that your body automatically knows what to do whenever the thought arises to move your hand or to take a step. Even steps have patterns associated to them, and there's pattern-based cells. There's central pattern generators in your spine that controls the walking gait patterns. If you're walking uphill or walking downstairs or dancing and skipping while you're walking, how your hands move when you're walking. That's a pattern that has to move multiple parts of your body all to stay in synchronization with each other. This all has to do with chronotherapy, chronobiology, and it's all something that we focus on during our two main protocols, because she has an audio system in her head, so we deal with vibration. Specifically, we're talking about mechanical vibration now. So that is what this tuning fork is providing. So we made sure that the things that we do with her body to help her heal are things that are parts of her body and sensors in her body that will take the vibration here and use it in the body. Auditory system uses vibration, mechanical vibration coming off of the tuning forks. And in her body, the sensors that are based off of vibration that are feeding back space, time, and qualities about the outside external environment, make sure that all that information gets fed back correctly, and that we have the ability to reset clocks. So the only thing that her brain knows about the outside environment is where things are in time, because we have things pressing against us, we have vibrations coming in, we have heat coming in, cold. When we step on things, when we touch things, we have sensors, touch sensors in our skin, under our feet, everywhere in our body. If you think about it, most of the special senses, hearing, smell, taste, visual, a lot of the special senses are all built in the head. The rest of the body takes care of the touch sensors, and they're really designed to tell the brain, the areas of the brain, where is it and what's going on with the external environment. And we take advantage of the vibration-based sensors throughout your body. And there's this thing called a Zeitgeber. And a Zeitgeber is, the meaning of Zeitgeber is time giver. And it's really meaning that the brain and the clocks throughout the body, the different cells and tissue that need very specific timing, how does it change timing with what it's currently doing? How does it know? How do those particular cells know that something's changing in the environment? So here's one of those aspects that you might need to think differently from what you've learned. Not all cells can change their timing based off of new vibration or new input. Not all input happens to be vibration, but it is some form of vibration usually. But we get new input from some sensor. Our body sensors have to be the eyes, ears, and feeling of our external environment. Otherwise, nothing gets updated. We do have internal sensors where one clock will set itself to the other clock. That would be called endogenous. And then we have these things called exogenous or external sensors. They're called Zeitgebers. They're the time givers that we can take external environment and update the timing of those clocks. We can adjust those clocks and synchronize them. And we usually think of the biggest Zeitgeber is the sun or lights or different things in our environment. Even as simple as lying down at night to go to sleep, behavioral patterns when you eat at certain times, and there are certain things that might trigger if they are repetitive and oscillating, rhythmic things in our external environment have to go through sensors here throughout her body, which updates the brain. So these Zeitgebers are the sensory system that allows your brain to permanently change these time rhythmic cells. And I say the brain, but actually there's things throughout your entire body, in your organs, in your muscles. There are different tissue that need certain timings in order to react appropriately and operate efficiently. So as we take our tuning forks and we hold the tuning fork over the body, we are taking the external sensors, which I'm going to talk about here in a minute. That's feeding back information to her brain. Where is this part of her body in space? Where is it in time? So that the body can know how long it takes for that impulse to get all the way up to the brain to where it's wired in the brain. And then the auditory system is the main system in the head, called a special sense. And we can actually do things with tracking and with binaural to be able to affect the inside of the skull. So you can see on the screen that we use two main protocols. We're going to teach you both of them, and both can be used at the same time within a session. So a typical session would be the person coming in, and within 45 minutes to an hour, we would work through a brain protocol, which we're going to show you in videos, and then you would use a full body protocol. These are things where you can use the same exact protocols over and over and over again. Then in follow-on training, more advanced training, we're going to get into things where you would focus on very specific protocols for, let's say, stroke rehabilitation or gait rehabilitation or things that muscle related, where you may do additional protocols specific to the way that the body works with rehabilitation of those certain conditions. But for right now, the brain and the body, we're covering all of our bases here, and these are things that can be done in every session. You take care of the pain and mobility. They come back for these sessions, and it really helps to be able to maintain what you're doing with things that might come back because or take longer to rehabilitate a person with certain movement or mobility conditions. And then there's the cognitive part of it as well, to whether you can keep that person's cognitive processes flowing correctly because of the timing that you're focusing on. So the type of things that we're going to deal with VCT, condition and diagnosis wise, you see that we deal with cognitive therapy, and the three subsets of that is going to be memory. We're going to show you how the brain actually does storage and recall. And this is very, very important because the way that your brain stores memory is very timing based. Where was it in space and time? The very interesting thing is that everything we deal with in sound therapy is timing and volume based. Behavioral as well. When we have certain behavioral things, all the way from things that we would think was, autism or spectrums of autism, or it may be even further into schizophrenia and things like that, where even if we're not able to resolve the actual conditions themselves that are wiring issues, that we can at least get the timings back to where in some of those cognitive or behavioral conditions, they actually get worse during certain times of the day. It's very well researched. And so there's a behavioral ebb and flow to the timing of behavioral things. And we're going to show you that the brain still tries to map things out and to predict things based off of the patterns that you had in the past. So you create a prediction coding, a coding in your brain, and that's really the way that your neurons are wired together. And then if something traumatic happens, now everything is thrown off. Your prediction coding has an error to it, and you try to process that error. And that brings us up into the stuck emotions that people talk about all the time. One of the things that you'll have to know from us is that sometimes we're going to present things to you with VCT that doesn't necessarily fall within the accepted principles within sound healing. There's going to be some things that we learned when we dug into, we had certain concepts that sound healing has across the board that may have been introduced years ago, and people still think certain ways with sound healing. But when we dug into a couple of these things, we learned that they're not necessarily supported from a biological or a scientific or a physics standpoint. And we will bring those things out on what we learned and allow you to make the decision on whether that's something that you want to change the way that you think, or if that's, there's going to be some out of the box sort of things that we're going to present here that aren't necessarily going to fit with the accepted principles. Stuck emotions is one of those things. To me, my understanding of the way that the body works in stuck emotions is that it's not energy being stuck somewhere, because energy gets moved out and transmitted out and doesn't have a stagnant capability somewhere in the body. Stuck emotions, if you look at it from the standpoint of the way the body works, is that the prediction coding on where everything is, the spatial aspect of your body, and how everything feels, the sensations in your body, it's all the same exact thing. So when you have a prediction error in your head, it might present itself as a continuing problem with your hip or your digestion, or maybe your knee hurts every time a particular trigger happens. We think of those as being the emotion, but really it's just a prediction error processing where your brain continues to remember sensations that you had in your body. It can actually trigger certain sensations to continue in the body. And we'll get very detailed and in an understanding of the whole stuck emotion part. So VCT really does deal with things like that. PTSD, very traumatic events, what happens to the brain, what happens to the body when it happens. How we have a prediction error that we just can't quite process. So we'll be talking about that with emotions. Speech therapy is another main area for us. There's a lot of timing in speech, and it really helps when certain things happen where we have music therapy involved, and I'll explain throughout our training how music therapy in the brain, understanding what the next thing is in a sequence or rhythm, being able to predict the next step in a song. A lot of times when you sing a song enough times, you know what's going to come next. You know the rhythms that are going to come next in a piece of music. And speech therapy, it really is about rhythms. The way that you use the emphasis on certain words, and there is a rhythm flow just like there would be in music and in singing. And feedback signals from auditory, feedback signals from a lot of different things, people moving to the rhythm as you're singing, but then there's also the feedback from when you're talking as well, and whether somebody is understanding what you're saying. You can see that as a visual feedback. And then there are certain things that we've learned from deaf clients through research. We can tell that certain people that are deaf, they can understand rhythms in different ways in using the different sensors. So we understand the research from that, and that really helps us with understanding timing that's based off of speech patterns. So if you're into speech rehabilitation, there's a timing aspect to that, and we'll make sure that even these protocols can focus on that. And then at some point, we'll design a very specific protocol just for speech therapy. But it has a lot to do with the pattern recognition. And even with stuttering and things like that, if you've ever noticed that sometimes when there's maybe a Tourette symptom or stuttering with some people, but when they get into singing and they actually sing, a lot of things disappear when you sing. The way that people have accents, you have people singing music in English and they don't speak English. So those sorts of things all come into play when it comes to speech patterns. And gait rehabilitation and motor function kind of go together. But the thing about gait, as I mentioned before, is there's central patterns that get generated in cells, especially in your spinal cord, where everything all has to happen in a certain pattern. It's multiple rhythms that have to get coordinated with each other. And your brain knows, and your brain actually has what's called grid cells. So the neurons and where your external sensors are feeding back to your brain are actually wired into like a circuit board, and where the neurons are firing from are located in a grid. And sometimes the spatial mapping that happens in our body, they don't get updated. That's why we have things like phantom limbs. That's why we have things like tremors, and we have gait problems where you're trying to step. For example, we had a couple clients with VFRT where we were actually through physical methods and in the weighted tuning forks to resolve a drop foot where the person was no longer dragging their foot. And once the physical restrictions were taken care of there, then the person still had the memory and the pattern that was happening in their brain and really needed some time to be able to reset that. Because the spatial mapping, the time mapping, all that comes into play. So it's hard to break that pattern, that habit, that rhythm. And we'll deal with that with gait rehabilitation. And then in motor functions, I've already talked about that with knowing that when our motor neurons are fired, it's coming from a certain part in our cortex. And when something is fired, how much it needs to be, where was our body to begin with. There's a huge amount of decision making, but then there's a big problem when the feedback comes back at the wrong time. We dealt a lot with that with VFRT, where we found that a lot of fluid gets built up. Like let's say that I'm swollen up here and I get a lot of fluid pressure. That fluid pressure starts to compress the nerves that run through this area. And when that happens, the brain is thinking it takes a certain amount of microseconds for that one sensor right here that I'm touching on my skin. It takes a certain amount of time for that to travel through here because of the length of the axon to get to my spinal cord, and then from the spinal column to get all the way up to my brain. That amount of timing is based off of what my brain knows of how long this firing sequence happens. So when I start to compress things and slow it down, now I have a timing issue. My brain doesn't know, was that feedback the consequence of what I just did with that muscle? Do I need to send more? I didn't get the expected result that I needed. Maybe I'll just send more power. We need more power. And just keep doing that. And the next thing you know, you're overdoing things, you're dropping things, you're stumbling. All those are the results of, of course, you think that you're clumsy. There's a reason why teenagers are real clumsy, tripping all the time and being uncoordinated. It is because their body is growing so fast that their brain has not been given the opportunity to remap and resynchronize how long it takes an axon. Of course, it's growing. That thread, that nerve fiber is growing throughout the day in a teenager really too fast. And then, of course, if they sit around and they don't move a lot, the brain has no ability to remap these cells and then regain its pattern and its rhythm. So what we do in the body protocols is We're going to make sure that the brain knows where everything is located throughout the body. And then this goes really well with if this is associated with physical therapy, or maybe you're a physical therapist and just need another way of helping you with your therapy and rehabilitation process. So I keep talking about the neuron. If you look on the screen, it's really important to understand how neurons work. We have the main body, or the nucleus of the cell body, and you see all those little branches coming off of them. Those are the dendrites. Those are a lot of times neurons are just taking information from a dendrite and then firing another pulse down the axon. And the axon is the thing that we usually think of when it comes to a nerve or a nerve fiber. Most of the time we think that neurons are in the brain and they fire down a nerve fiber into some part of the body. That would be an outgoing nerve. That would be more likely for a lot of times it's for timing of certain things. Our nervous system is really about timing, whether that's like a motor system or something like that, or the way that your heart beats, or the respiration that you have, the way that our body does certain processes, even with the organs themselves. But that axon is one long fiber that goes out and has little feelers on the end of it. The little feelers can be, if it's outgoing, maybe those feelers are attached to muscle fibers that contract when a pulse is sent down that axon. And then if you reverse the process, what's on the end of those feelers for sensory things that are underneath your skin, now they're waiting for something to happen on the ends of those sensors, those endings, those sensory endings, whether it's a pressure sensor, whether it's heat and cold, whether it's something that's for pain, different types of pain, chemical reactions. Those things will actually send information back up the axon to your spinal cord, and then further up the spinal cord. And there's actually decisions made in your spinal cord as well that we'll get to. Then there's things wrapped around these Schwann cells that are wrapped around some of the axons. What's important for you to know, and I don't want to dig too detailed into this at this point in the introduction, but it's important for you to know that the length of the axons, the speed that sensors fire up those axons, it's very important. The timing and the speed of those. We usually think of MS, multiple sclerosis, as the Schwann cells starting to degrade, and they're being built by glial cells and maintained. They're just nothing but fascia strips that are wrapped around, and what they're designed to do is to allow the axon to fire very fast up that axon. And as those supporting Schwann cells and myelin sheaths is what they're called, when those start to degrade, now the timing is completely off, and it is because it's off because of a physical deformity. And a lot of times we can help to remove some of the barriers to that on a physical sense with VFRT, but then any changes you make to what the brain knew about the body at that particular time, you need to tell the body something has changed, and that's where VCT comes in. So we're going to get a really good understanding of neurons in this training. And then the senses that we deal with, if you look at the picture here, we're really talking about underneath the skin. So when vibration is coming in from this tuning fork, it's going to reach the skin. And one of those other things that we looked at very deeply is to understand that when vibration hits the skin, what happens? Does that vibration make it, how far does that vibration make it into the skin? And again, this is another thing that my understanding of vibration, using it with 22 years in the Navy, is that the ability for this tuning fork to have enough mechanical vibration through the air than what happens when it actually hits the skin, and how deep can it actually get there. A lot of us in sound healing think that every little cell, that if I strike this tuning fork and I'm out here, that vibration is going to make it not only into the skin, but it's going to make it into the bone, it's going to make it through bone, and it's going to take every cell in this person's body, and they're going to change the resonant frequency of the cell and those sorts of things. We're going to tell you something different in VCT, and it has a lot to do with just the physics of how this sound travels through the air and what happens once it hits the body. We're more likely to, by the way, we're holding it 3 to 5 inches off the body in VCT, we're more likely to activate the sensors underneath the skin. That's what you're seeing in this picture here. In this picture, there's a couple sensors that we consider touch-based sensors or tactile sensors. They're sensors that are not only just underneath the skin, but they can also be deeper into the skin as well. We're talking about Meissner corpuscles. We're talking about Merkel discs. Those are the things inside the pads, just underneath the pads of your fingers. If you think about how can somebody that reads by Braille able to tell the depth and in a dot pattern when they read Braille, that's because these Merkel discs are just underneath the surface of your finger pads. And then there's the Ruffini endings, which are also deeper into your skin, and the Ruffini endings have a lot more to do with movements of your musculoskeletal system. And then there's what I would consider the best, the rock star when it comes to tactile sensors, is this Pacinian corpuscle, which you see on the left side of this picture. The Pacinian corpuscles are very well suited, and I think they're at the basis of everything that we do with sound healing and vibration hitting the body, and how do we feel sensations when it comes to vibration. A Pacinian sensor, if you look at it, it's got something in the center, a neuron ending, and that's the actual thing that sends a pulse up that axon. But then it's surrounded by all these different layers. It's kind of like an onion, but each one of those layers has fluid in between them. And even when you do not touch the surface of your skin and you send vibration into the skin, it's the Pacinian corpuscles that actually can deform without touch. And not only that, but it's fast enough and rapidly adapting. So what that really means is that when you first start putting vibration on the person's skin, that these Pacinian corpuscles will deform, and then it will be enough deformity to send pulses up to the brain. But then what happens afterwards is it adapts because of the physical construction of that ending, and it won't continue to report things up to the brain until something changes, and that would be either it stops or the increase or the intensity increases. Then also the ability for the vibration, the communication from the vibration, the amount of times that you get a vibration is the exact amount of times that a pulse will be sent up to the brain through the spinal cord. And that's very important when it comes to vibrational chronotherapy. A lot of times when we put vibration into the body, these sensors that sense vibration, they're only firing sometimes. When the Pacinian corpuscle actually fires, it fires at the exact same rate, or tries to fire at the exact same rate as the frequency of the tuning fork that you're using. So that way, when we use 120, or let's see, in this case, 256 hertz, when I'm putting that into the body or holding it above the body, that is the exact same frequency of oscillations and pulses sent up to the brain. So that's pretty important for vibrational chronotherapy, especially since we're using that as an external Zeitgeber to change the rhythm of the brain, and to also have the body show where everything is in space and in time. Another thing that we use, the reason why we do our brain calibration, where we're holding the tuning forks near the auditory canal when we're near the head, is the skull is a big barrier to vibration. And this is another one of those areas where one of the accepted principles in sound healing is that we can put vibration into every part of our body, and that it could travel, so the sound can travel through bone. And that anatomy-wise, that's a very hard concept to get past. And as you dig deeper through that, if you go into the and speak with an ultrasound technician, or look through the literature for ultrasound, which is high frequency sound with a paddle, and you're trying to put vibration, mechanical vibration into the body for it to be bounced off of these various layers of density, that bone is a big deal. They actually have to position these ultrasound paddles in a certain way to get through or around bone, because when it hits bone, it bounces off or stays inside of bone. And it is really based off of density. When sound hits density of greater differing densities, it bounces off. Just like when I'm talking here in this room, that the air density and the density of the wall behind me, that most of that sound is going to bounce right off the wall and echo around the room. The same thing occurs when I'm talking to her, to Lucy. My vibration is coming right into her skin. A lot of it's bouncing off because the density of her skin, the outer skin, is much greater, different than the density of the air. Then when it gets to bone, that's a huge density difference. And it's a lot of that's just going to bounce off and echo right off, or reflect right off of the bone. That's a problem with the skull. When we're trying to affect the rhythm in the neurons inside of the skull, there's a lot of layers there with differing densities. We have some soft skin in her skull, and then we hit the bone of her skull, and there's a thickness there. A lot of that vibration, especially if it's introduced from the air, a lot of that vibration is going to bounce right off that skull, and you're going to lose a lot of the decibel intensity from this tuning fork. So when it comes to dealing with neurons inside the brain, our best route is through the auditory system, through things like binaural and monaural input right through the auditory canal. And then we're going to talk about the different ways that your brain processes the auditory system. And that's been a well-known and a well-researched process. In fact, the brain is one of the best researched processes, especially since you can use EEG and a lot of the diagnostic equipment. That's something that has a lot of data out there as far as the auditory system. So we're going to use the auditory system when it comes to the brain calibration, and we're going to talk to you about the science involved in that. So this was just an introduction, just to show you or talk to you about VCT. When it comes down to the actual processes, it's nothing more than we're just going to hold the tuning fork, we're going to strike it with some sort of striker like this, and for the full body calibration, we're just going to hold it real close to the body. You can see that everything that we're doing is getting up close to the body. We're using the nervous system, we're using the vibration sensors in our skin to do certain things. When we get near her head, we're going to be doing things like binaural, using 2 tuning forks, one on each side, and we're going to hold them near the ear canal. We're actually going to do tracking, which is using her, well, she has her mask on right now, but we're also going to make sure that the auditory system around her eyes can also calibrate itself with the visual acuity in what we call horizontal tracking. And we'll use the tuning forks to make sure that her audio system can still pick up where everything is in space, which is a very big deal when it comes to what the brain knows about its external environment, because again, that's a Zeitgeber that's feeding information in from a sensor. And it's also a very big thing for balance. And it's also a very big thing to make sure that what you're seeing and what you're hearing all match up. And a lot of those things, when you start to peel back those layers, we can start to undo some of the things that happen to us over time that we don't realize. That we may have had what didn't seem like a traumatic event a long time ago that kind of lead up to, we continue to have greater and greater prediction errors over time, and our body just can't get back into synchronization because there's what the brain thinks is supposed to happen and what the body is telling the brain is happening are two way different things, and these synchronizations just can't synchronize to each other anymore. When two gears can't align together anymore and synchronize, they break. But we have timing systems that can actually are supposed to be connected to each other. They can actually do what's called free running. And for emergency reasons, I mean, if we had one traumatic event and we were like a fainting goat, our systems would shut down like that if we couldn't possibly separate the timing of the two in free run, because in free run for extended periods of time. So what we're going to show you at the beginning in these videos, we're going to show you the protocols and how to use them from a clinical standpoint. And that way, if you want to do this for your family, that's okay. If you want to do this as a living, that's okay. And we're going to deal with it from a clinician standpoint. And you're going to have the science behind it, so that you can go in and tell your clients or tell somebody from a professional standpoint, look, this is not pseudoscience. Here's exactly what we know about the body. Here's the tuning fork that can change what the body is doing. And that is at the essence of what we do in vibrational chronotherapy. I want to thank you for joining us for this journey. What's going to happen here is you can have the ability to watch through these videos in sequence through our site, and then at a certain point you're going to be given the ability to prove what you know, and the outcome of that will be a certification through NEC Academy, so that you can use that in a professional setting if you choose to do so. So more information would be presented in other videos, and we thank you for joining us on our journey.